Good afternoon, everyone. Welcome to PATH, Patient Advocates Transforming Healthcare, Tuesday Table Talk. As you know, we join with you every Tuesday at 2 p.m. Eastern for our weekly chats with various healthcare leaders. And I'm really pleased to welcome today Matt Langinger and Tristan Codrington, both from Public Agenda. Matt serves as a Vice President of Public Engagement and Tristan is a public engagement associate. Today's topic is one of, I know, great importance currently and obviously in the past, but more so now more than ever, given our current situation with the COVID-19 pandemic, as well as the current discussions in our country around structural racism and racial justice. And so I couldn't think of a more appropriate time to really dive in a little bit deeper into the topic of building trust in healthcare. And so I wanted to share that today's talk will also reflect on some of the work the Public Agenda's public engagement team has done around building trust, specifically with the American Board of Internal Medicine Foundation. And I know that Matt and Tristan will be very happy to share some of that information during our talk today. And so before we begin, I just wanted to also remind our viewers that you can put your questions in the YouTube chat as long as you are signed into YouTube. So please feel free in the next 25 minutes or so to share your questions, and hopefully we'll be able to share them with Matt and Tristan today. Now, Matt and Tristan, I can honestly say that your job is certainly not an easy one to tackle this topic. And so I commend you on your work. I know for me, looking at, building trust is such a multifaceted discussion. And, we can talk about the historical context, obviously, around the building trust in healthcare. We can talk, obviously, about the structural racism that is associated with that. We also now live in an age of misinformation. And I think that's also contributed to, this eroding trust that communities may have. I'll also even dare to say that I think some of the consumerism of healthcare has perhaps led to some of the erosion of building trust, because we know the constraints that are placed on healthcare teams and systems that really take away time from building those relationships with patients, families, caregivers, and more broadly, communities. And as everyone knows, as someone who's a patient family engagement consultant, I really value the partnerships that we build as part of the team. And I think that obviously takes a lot of work and a lot of investment and commitment to that engagement. And I think lastly, I'll share that one thing that's kind of struck me, and I'd love to hear your thoughts maybe later in the discussion, is as I've had more conversations around trust, there's been a lot of people that I've discussed it with that have said, part of it is I'm not even being asked what I feel or what my opinion is. And it's automatically assumed that I don't want to be engaged, that I don't have the ability to be engaged. Yet if someone were to ask me, I would want to be. So that's, I think, something that continues to come to the forefront in a lot of discussions I have. And I would love to kind of reflect on that maybe later in the discussion. But let's go ahead and just start about the Building Trust Initiative with the American Board of Internal Medicine Foundation. If you guys could just give us a high-level overview of that, and maybe we could just start there.
Sure. And the themes we're talking about here are kind of themes that are been part of Public Agenda's work since we were founded. We were founded in 1975, actually, to help kind of strengthen the relationship between citizens and government, between people and the institutions that serve them. And we do this work in lots of different issue areas, including, but not limited to health. And as you say, I mean, a core element of strengthening that relationship is the engagement, is the kind of interaction, people being asked what they think, what they want, and kind of doing that in ways that do build trust between patients or residents, citizens, and the people who are trying to serve them. With this particular project, the ABIM Foundation reached out to us about working on this, and they're a foundation which has been around since 1989, and they are focused on kind of the values of medical professionalism and raising quality in healthcare generally. And so they've done projects on lots of different kinds of things. One called Choosing Wisely, which is about getting healthcare consumers / patients with caregivers on kind of how they make choices about their treatment and costs and like that. And this is a natural kind of extension of that. How can you rebuild trust, both at the level of, people and their nurses, doctors, other caregivers, and also at the level of communities and health systems. So that trust is important to build at all those different kinds of levels. We have also been working with this on this project with another good colleague, Gwen Darien from the National Patient Advocate Foundation, who's been really instrumental in our thinking. So let me turn it over to Treston. And by the way, also thank you, Hala, for inviting us here today, and also for participating as one of our commenters on the Building Trust dialogue. Treston, why don't you talk about?
Absolutely. Thanks, Matt. And thanks, Hala, again for making time and space for us today. So just a little bit about how we underwent this process. So we started, interviewing a couple of people that we know, advocates, people, with a lot of perspective on what trust looks like in the healthcare system, sort of evaluating where we stand. And to no one's surprise, we don't stand very well as far as building trust in the healthcare system right now. So we convened several different people from all different aspects of the healthcare industry into this asynchronous dialogue on the Slack platform, which I'm sure many of the viewers are familiar with from communicating for folks in the office. But we used it to sort of have this sort of prolonged, almost 2-month-long dialogue with all of these folks, talking about what does it take to build trust? Where do we stand with trust right now? How do we move forward? How do we even begin to move forward? And when we initially went into this, as was said before, COVID-19 was not really on the front of anyone's mind. And COVID-19 hit, that added another layer to the dialogue, but also the really revitalized collective consciousness of racial discrimination and racism and systemic racism in this country also really added another layer to this dialogue that I don't think would have happened otherwise. And one of the major themes that emerged from this dialogue kind of through and through is that trust is hard to establish when the roots of the system are founded in inequity. So basically, before we can even begin to think about or talk about how to rebuild trust in the system, we need to really truly acknowledge where we're coming from. A system that is mired in racism and the effects of wealth and income inequality, sexism, homophobia, and all the other phobias, all the other isms that the system is mired in. And not just saying that, but really, really digging into the ways that it concretely affects the system now. And we really got into that in the dialogue in these sort of very systemic sort of ways, and recognizing that at the end of the day, a lot of times people who receive care end up being blamed for not trusting the system, but they have a lot of good reason to not trust the system. Some other things we talked about included diversity and inclusion. And I know, Hala, that's a major point and something that you really contributed to that dialogue, especially as far as that, we want to engage, or we say that we want to engage diverse and inclusive groups of people, but we're not really doing that. And one of the reasons why we're not really doing that is because the people who are making these decisions, who are leading institutions, the people who are crafting these engagement initiatives are themselves not diverse and inclusive groups. So, to beat a phrase to death, or to use a cliche, we have to be the change we want to see inside of these institutions. They need to diversify and be more inclusive before we can, say that we are bringing other people to the table. We, as much as we want to bring folks to the table, we sometimes have to bring the table to them as well. So thinking through ways that there can be, greater partnerships between community members, health systems, and involving, members of government as well, in ways that don't necessarily require, community members and residents to do the extra legwork. Sometimes the institutions need to be the ones doing the extra legwork. And it can be things from as simple as, mobile clinic models that bring things to the community, but also community dialogues that take place on community turf, really. And having advisory boards that actually are composed of community members and not just professionals or non-physician or non-clinical health professionals, but actually having these boards composed of community members and having their voices really raised, were some of the things that were mentioned. And also greater data transparency and accountability. If we want to be trusted, we have to figure out, do we deserve trusting? Can we really say to the public that people in the health system deserves to be trusted? How transparent are we with disclosing on safety and quality, measuring medical errors, meaningful shared decision-making, and informed consent? And then, of course, as far as thinking towards the future, how can we move towards a more trustworthy system? How can we design spaces? So the physical layout of spaces, as far as, and also processes, how can they be designed that they can be more patient-focused and patient-centered? So these are just some of the things, and I could go on and on and on because this was, again, almost 2 months of dialogue. But that's kind of an overview of the many, many things that we talked about.
Thank you, Matt. Thank you, Tristan. Just an FYI to our viewers, Tristan, because you're joining the audio through the phone, it's not showing you on the YouTube stream. So I just wanted to give you a heads up that unfortunately Zoom is focused on your audio and not your video. So if anyone out there is from Zoom, please work on some of these tech issues that we seem to run into during these. But I just wanted to let our audience know of that issue. You brought up so many, we had such a rich and robust discussion through the Slack channel, and I mean, so many places we could start here. But I guess, as you all reflect on some of that, dialogue and some of what you've seen in your work, what do you kind of see are the next steps? If, we have a lot of health system leaders who join these table talks, as well as those in patient advocacy and community organizations and patient engagement leaders. What do you see as, next steps? If someone were to approach you and said, okay, you've learned all this, now what do I do with it? What is the first logical, meaningful, purposeful, good next step to take? And I'll throw it to either, Matt or Tristan.
So one next, as we look at each other to see who's going to respond, and I'll let you chime in. But I mean, one next step with this particular project is that you will produce a whole set of practices, at all these different levels, very simple sorts of things that, like if you're a physician, for example, or a nurse, using your screen not as kind of a shield in between you and the person, the patient you're talking to, but as something that can facilitate more of a discussion about, situation and the decision to be made or whatever, very simple sorts of things, all the way up to much more ambitious sorts of projects that could be community level sorts of things where hospital systems and other kinds of community organizations might be working together. So we'll have this whole list of practices. And then of course, according to where people feel they are, in their situation, their community, if it's kind of trying to figure out how to work better with their caregivers or whether they're trying to kind of change the way that the community and the health system interact, obviously there'll be kind of things to talk about and to approach other people, other potential allies on.
And I'll also say that in this process, we've learned about so many ongoing practices or things that have happened already that have been really interesting models that are happening on very localized, small levels. So really highlighting those things, putting a spotlight on those practices, and not just only giving them more voice, but also hopefully drawing more attention to them so that they can be scaled up to sort of national levels. Because there are a lot of good practices out there, and there's a lot of good progress being made. They just need the spotlight and the resources dedicated and focused on them.
And by the way, just people are welcome to submit practices. That's another part of that's not the main thing we're talking about today, because we're talking about this online dialogue, but anyone who wants to can submit a practice to the ABIM Foundation for consideration as being something that others might want to use. And there's a form, if you go, maybe I'll put the link into the, I guess I can't put it into the chat, can I, Hella? But
if you want to send it to me, I can
Awesome.
include it in once I post our discussion.
Cool.
I'm happy to include that link.
Awesome.
So, Tristan, I kind of wanted to jump back at a point you made, talking about investment. And I think this is something we talk a lot about, but you know, the reality on the ground sometimes is very different. And so, you know, we you know, at least in patient and family engagement work, we talk a lot about strategies and we talk a lot about how to make these partnerships. But then when it comes time for that investment, right? The investing of our time, our money, our effort, our training, you know, that's where we seem to start really having a lot of gaps. So it would be really helpful to share, you know, in the dialogues you've had and the practices that you've heard about, where do you see, you know, that groundswell of investment coming from, or how do we make bridges to funders or to health systems to really acknowledge and recognize the necessity for the investment? Because as we know, a lot of times in terms of, you know, community partners or patient family engagement partners or even advocates, it's expected to be a voluntary effort sometimes. Or, you know, I'll be quite honest, a lot of my work I've had to spend taking a lot of time of, you know, educating myself on various healthcare issues beyond just the ones I already know because of my own personal experience. And, you know, there's times where I'm just like, wow, I wish there was a training program or something that I could have to help support me be more engaged and be more accessible and able to really be as productive as I can be as part of a team. So if you could share some of that, I think that would be a really interesting for many of us to learn about.
Yeah, I'll share some thoughts, and then Matt, of course, feel free to jump in as well. But you know, funders definitely have a huge role, and foundations have a huge role to play in moving us forward, and realizing that there are so many intersections in this work, right? The intersection between civic engagement, public engagement, and health and the environment. You know, there's just so many different intersections here, and it requires, again, that sort of diverse, inclusive mindset of bringing people together to really realize that there are so many different connection points and flashpoints. And I guess there needs to be a higher prioritization of this kind of work, realizing that, as you're saying, people take time out of their personal lives to try to do this work that's so necessary and should be considered fundamental and should be kind of a step one sort of thing. But unfortunately, there's still sort of this mindset that this is like sort of something extra, something optional. And that really needs that culture needs to shift into seeing this kind of work as vital and necessary. But I think, you know, I believe really in the power of storytelling and really in the power of connecting to other people's experiences. So really shining a light on these connections and these intersections of justice, of health, of the environment, of the economy, and really showing how these different things are connected will really speak to wider audiences, including funders, to really wake up to the reality of the importance of this.
Yeah, no, I think, you know, we're at, for all the crises of 2020, all the awful things that have happened, there are certainly some silver linings. And one silver lining is that it does create, like any crises do, an opportunity for change. You know, more of a recognition that, you know, things need to change, that investments need to be made. You know, and certainly you see, you know, philanthropic organizations. I mean, ABIM Foundation was already determined to do this before 2020, but they certainly should be commended for this. And you know, other foundations in the field, the Robert Wood Johnson Foundation is another. They're willing to, you know, they are investing in many of these sorts of things. But part of the challenge that we face and that we haven't really met in previous crises is giving people a chance to kind of figure out what they can do together. I mean, in many crises, you got people demanding change, or demanding what is an unacceptable situation, which is very important that happens, of course. You've also got people in positions to make changes of one kind or another who may be receptive to that message and agree that this is not this is an unacceptable situation, but they're not quite sure exactly what to do. And so you see changes that aren't necessarily the right things that come out of past crises, or no change at all, because people just couldn't figure out how to overcome the barriers. And there's always barriers. Things are always more complicated than you think. And so that's where engagement comes in. That's where you have to have, like you were saying, Hala, the communication, between people who are receiving a service and the people who are trying to design and deliver it. There needs to be communication there about, well, what exactly do you need, and how can the investment actually really help you, and vice versa. And people who are trying to help need to be open about the obstacles and barriers, political, financial, otherwise, that they face, and again share those and talk about those in a way that people can actually strategize together about what to do. It takes that kind of ongoing communication, and it can happen online, it can happen in person, it can happen in a variety of ways, but that engagement needs to happen. Otherwise, that we won't then take advantage of the silver lining, at least, that we've been given through these awful crises we've been facing.
Right. Completely agree. We did have a question come through the chat, and I thought maybe we could spend the last few minutes talking a little bit about this. It says, I'm wondering how consistent trust building practices are across sites, or is it always localized? And I think that's a great question. And I'd love to hear what you guys have observed in your work thus far regarding it.
Justin trying to unmute himself, I think.
Yeah. You're on mute.
I think you have an answer to this.
Looks like he's having some issues. So Matt, do you want to go ahead and start?
Well, I think that there are some core themes, and one of the things that we've covered through the online discussion is that I think there's probably more of a shared sense of things across different places than there are differences. Obviously, there are differences. Places are different, situations are different, people are in the health system from different vantage points. That's all and important to recognize. But I think there's more in common, I would say, and more of the practices have kind of some core, common ingredients than not. But Justin, are you back with us? You want to expand on that?
Yes. Can you hear me?
Yes. Go for it.
Fantastic. Okay. Yes, that's definitely a great question. I think when it comes to sort of these overarching themes and realizing, I think if 2020 has taught us anything, it's the importance that so many issues are systemic and they go beyond one location. And one thing that one neighborhood faces, another neighborhood 1,000 miles away is probably facing something similar. But also the importance of local context is also extremely important. So it may be the same sort of, similar take or similar stride, but adding the local flavor, adding the local context is important. And also, the little touches that make a difference between, what you would do in one place or for one community versus another. For example, one of the practices we found about these photonovelas that a hospital system was doing, sort of taking the sort of, Latin American soap opera and putting it in a comic setting, appealing to that audience as something familiar, right? And something that they could connect with as far as, and the photonovelas were focused on cancer screenings and to encourage cancer screenings in Latino populations. And it was effective, right? But that might not be something that works necessarily somewhere else, right? Where there's a different culture of health. There's lots of talk these days about building a culture of health. So there may be an overarching culture of health with similar goals that we're moving towards, as far as breaking down barriers of language, of race, of gender, and all of these other things. But you really do have to take the time to understand local context and make sure that you have that represented with the people that you're working with in the community.
Absolutely. Thank you. Well, we have about a minute left. I just wanted to kind of wrap things up and see, like I alluded to in the beginning of the conversation, I'm sure that the work has completely changed since the pandemic has hit us, since we find ourselves in the midst of many protests around racial injustice that sadly we always knew was there, and yet the pandemic shined a very bright light, and the tragic events and brutal murders of many African American men and women at the hands of police brutality have really amplified the need for us to engage in such conversations, building trust across a lot of different spheres, not obviously healthcare. But I guess if maybe last 30 seconds or so, what have you seen as the biggest barrier and perhaps opportunity ahead in terms of building trust in healthcare, given our current situation?
I think what's happened is that it's both a barrier and an opportunity, which is people are recognizing that systems need to change. It's not simply about individual conduct or individual biases. Those are important. It's important to address things at the individual level, absolutely, but we can't just stop there. We have to kind of focus on the institutional things. We have to create spaces within institutions for people to share their experiences, like you were saying, to acknowledge that there are differences. So we figured, let's acknowledge that there are differences and focus on how they're positives. And to deal with things like evidence and data, that all these things need to be woven into the way that institutions function and the way that people interact with those institutions. So that wasn't a positive and a negative like you wanted, but maybe it's helpful.
No,
well,
it's
in 10
helpful.
seconds, I can throw in the positive end. If the power of these institutions can be harnessed for good, that institutional pathways can be created to address change, that would be monumental. And some things are fairly easy, easier than others, that could really, really make huge differences on a systemic level.
Yeah. Well, I will leave it on a positive note. To our audience, we all have the power to change. We just need to make the steps and make the commitment to do so, whether it's in healthcare or in society at large. And I thank you, Matt and Tristan, for joining us today on Path Tuesday Table Talk. I hope maybe in another few months or so, we can revisit the conversation and see where you are in the initiative, and share with our audience, how the information is going to be disseminated, because I'm sure there's a lot of organizations who would love to hear about those practices and have those real world approaches that they can also utilize as well. Thanks again to our audience for joining us. Join us next week for another Path Tuesday Table Talk, always at 2 p.m. Eastern Time. Next week, we'll be discussing healthcare transformation and patient-family engagement. Thanks again, Matt and Tristan, for joining me. And thanks again to our audience. Have a great day. And Matt and Tristan, if you could just pause for about 30 seconds as we end the live stream, and then I will let you know when we're done. Thanks so much.
Thank you, Hala.
Thank you.